It's a good afternoon to you and welcome to Asake Online. We are here at Thorngrove Hospital for a handover of equipment which was donated by OSISA. We know that over the years or the last year, we've seen a number of people donating a lot of stuff, sanitizers, gloves, and part of the equipment. We also know that a lot of people have worked on this hospital from the first time that we came here and to what it is today. Today, OSISA is handing over a number of quite impressive pieces of equipment. These include ICU beds, resuscitation trolleys, chairs, desks, mattresses, as well as protective clothing. This will go a long way in making sure that the Thorngrove Hospital is actually a place that is hospitable to those who will be admitted here. We know the cases are going down, but the question is for how long? People are already talking about the third wave. And as we know that the lockdown restrictions have been lifted, so we are likely to see more cases going up. So let's hear what is in store for us at the Thorngrove Hospital.
His Worship, the Mayor of Bulawayo, Mr. Solomon Mkuni, Honorable Minister of State for Provincial Affairs, responsible for Bulawayo Metropolitan Province, Honorable Judith Ngube, the Chairperson of the Health, Housing and Education Committee in the City of Bulawayo, Councillor Mtanda, Director of Health Services, City of Bulawayo, Dr. Sbanda, comrades and friends. It is my honor and privilege to participate in this ceremony to hand over personal protective and hospital equipment to the second largest infectious disease hospital in Zimbabwe, Thorngrove Hospital. This is not the first time that my organization has collaborated in support of protective personal equipment. This is the second such large support. Earlier, we supported the Mutare Infectious Disease Hospital. This is in 2020. On March 11, 2020, the World Health Organization, WHO, declared the novel coronavirus COVID-19 outbreak a global pandemic. Since then, massive negative impacts have been witnessed around the globe. A surge in confirmed cases running up to over 2 million deaths globally, a severe strain on the public health systems of many countries globally, including the inability to cope and respond to the pandemic effectively. Over the course of 2020, the COVID-19 global pandemic forced governments to enter into a crisis and emergency mode, with the recurrent ordering of national shutdowns, or lockdowns as they are commonly known, curfews, travel restrictions, and bans on public gatherings, as well as shutdown of industries, including the aviation industry, tourism, restaurants, schools, and including beverages, alcohol, and restaurants globally. This was coupled with other social and public health restrictions and regulations in an attempt to curb the spread of the coronavirus infections. These strict measures also resulted in severe economic, social, educational, psychological consequences for millions of citizens across our region, but also beyond. Economies have been highly impacted, and inequalities of all types have been deepened and aggravated by this pandemic. Of further concern has been the increase in the violation of fundamental human rights and unjustified limitations of freedoms by a number of countries in our region, but also beyond, under the guise of enforcing COVID-19 public health and emergency regulations and measures. Noting this dire and untenable situation, the Open Society Foundations globally released the sum of $130 million to support countries globally to respond to the coronavirus. The Open Society Initiative in Southern Africa, or CISA, took a multidimensional approach to responding to the effects of the crisis in our region in Southern Africa. In total, OSISA released and invested over $6 million in 12 SADC countries. These investments have included but not been limited to critical investments in information dissemination, in awareness raising around the pandemic and how to prevent it, strengthening access to testing and treatment for all, mitigating social and economic effects of the pandemic, particularly for those living on the margins of society, providing support to investigative journalism to spotlight excesses, including government excesses and mismanagement of funds, health funds during this crisis, fighting against disinformation relating to the pandemic, and also calling and supporting transparency and accountability for human rights implications related to responses to the pandemic. Our interventions have sought to reach various vulnerable groups affected by the pandemic, including the youth, the elderly, healthcare and frontline workers, people living with disabilities, women, informal traders, human rights defenders, investigative journalists, and LGBTI communities and the teaching community. Zimbabwe, because of its geographical location and proximity to South Africa, has seen a rise in infections amidst the detection of the new COVID-19 variant and the rise of the second wave of infections. As of the 22nd of February 2021, Zimbabwe had recorded 35,796 confirmed cases. The country's COVID-19 test positivity rate are on the rise, estimated at 30%, meaning that 1 in 3 people have tested positive over the past few weeks. This is higher than the first wave and higher than the World Health Organization recommended rate of less than 10%. The positivity rate is a clear indication that the virus is in the community. It has reached the community and it is now inside the community. Researchers have reported that the recovery rate of 95% during the national lockdown, but has since plummeted to around 58% and 60%. To date, OSISA has invested almost 800,000 through support of short to medium term advocacy, research, service delivery related interventions in the country, and that is 800,000 United States dollars. The investments have been varied and have targeted a whole range of activities. Through the association, the Zimbabwe Association of Doctors for Human Rights and the Nurses Association, OSISA has supported the provision of material and technical support, PPE, oxygen, fluid and antibiotics to 4 health facilities and their health workers, strengthening community awareness on prevention and control measures of COVID capacity development, providing psychological support to healthcare workers, and mobilizing and organizing nurses to support their protection in the health workplace. We have partnered with media organizations to coordinate the dissemination of credible information around the COVID pandemic, including on infection, including on the way in which to prevent the spread of this virus. We have supported the provision of protective tools and equipment for journalists working on covering the pandemic, as well as for artists working to showcase and highlight the effect and the impacts of the pandemic, as well as raise awareness about it. We have worked with the teaching community to support teachers to make the teaching workspace safe and to push for conditions for education facilities that are safe from COVID pandemic. We have also worked with nurses associations, we've worked with healthcare workers, pushing for a safe workplace related to the prevention and response to COVID. In addition, we have worked with human rights organizations, providing support in the wake of a surge in human rights violations in responding and enforcing COVID. Some of the human rights organizations we've worked with have supported the litigation in relation to ensuring that government and other responsible authorities meet their obligations towards not just citizens, but healthcare workers. The use of arts has been critical to responding to the COVID pandemic. We have provided support to arts and media to document and raise awareness of the challenges faced by young women, persons with disabilities, and other marginalized groups in order to ensure that attention is paid to these groups by governments and other authorities in responding to this pandemic. It is notable, and I will mention that we collaborated with the Intwasa Arts Festival last year and Cultivate Africa in 2020. Finally, we have worked with local authorities and health facilities across the country. As I indicated earlier, we provided support to Mutare Infectious Disease Hospital last year, and this year we have provided support to Thorngrove Infectious Disease Hospital via this donation of 30 hospital beds, mattresses, 10 intensive care ICU beds, intravenous drip rods, resuscitation trolleys, tables, chairs, cardiac tables, and medical gloves and gowns for nurses, doctors, and other healthcare workers. We believe and we hope that our support will go a long way in saving lives and complementing the efforts of government and other non-state actors, all of whom are actively involved in helping fight the COVID pandemic. We applaud all these efforts and call on governments to please ensure that as they respond to the pandemic, they ensure that current rights are protected and guaranteed, and if possible, even expanded, given the fact that by its very nature, the pandemic has resulted in the restriction of rights. I would like to thank the Mayor once again, Honorable Minister Ncube, and of course the councillors and the Director of Health for this opportunity. And I wish you all well, and I hope that we will be ready and readier to fight the pandemic as we go forward. Thank you, Ngiyabonga.
The City of Bulawayo is grateful today to be receiving this big consignment of the state-of-the-art hospital equipment, which is essential in the fight against the COVID-19 pandemic. A number of cases that have been recorded in the city and in the country have been increasing since reports of the first COVID-19 pandemic was recorded last year. The pandemic posed a number of challenges for healthcare workers and government alike. The challenges which were faced by the City of Bulawayo and the main other local authorities was the availability of enough hospital beds and equipment to cater for the increasing number of cases. There have been several efforts to curb the increasing number of cases with the recent lockdown and inoculation of the COVID-19 as some of the measures which government has taken. While the lockdown has been lifted, we continue to urge the residents of Bulawayo to stay at home, wash hands frequently with soap under running water, and exercise physical distancing. The battle against COVID-19 will only be won when we all join hands and to fight together. Ladies and gentlemen, the unit of purpose which has been shown by the residents and partners of Bulawayo, we have come on board to assist council in ensuring that we have enough personal protective clothing and hospital equipment cannot be overemphasized. This partnership has sustained the city for the past year and they continue to do so. Today we received this donation from OSISA at a time when we have opened the refurbished Thorngrove isolation ward for admission of COVID-19 patients. It is a shot in the arm for the city of Bulawayo and indeed the province and the residents of this great city of kings. We received the state-of-the-art hospital beds, equipment and personal protective clothing for the healthcare staff, which will ensure that the patients admitted at this hospital have the greatest comfort. The consignment is key in ensuring that we provide quality health services for the residents of this city of Bulawayo, which is important in the upholding of human rights. Ladies and gentlemen, may I take this opportunity to express my gratitude to the OSISA team, ably led by Mr. Siposami Malunga, for the efforts and hard work in ensuring that we receive this donation as Bulawayo and in joining the city fight against this pandemic. May this partnership that has been forged continue in the upliftment of the rights of the people of Bulawayo and ensuring that efficient service delivery in all spheres becomes our priority. I thank you all for gracing. Honorable Minister, I want to thank you for being on the forefront of our COVID-19 response and mitigation measures. I thank you all. Siyabonga.
Siyabonga, Your Worship. Besicela lisisukumisele u-Honorable Minister as she gives us a speech. Siyabonga.
Thank you, Siyabonga. Ladies and gentlemen, Honorable Minister of State for Provincial Affairs and Devolution is no stranger to us all. She has been working closely with us within the city, within the province. As you are aware that the city's boundaries and the province boundaries are the same. So she's one of us. She has committed most of her time to ensure that the local authority and the province have a seamless government where we work together to serve the same people that the local authority is serving, being the same people that the province is also serving. Ladies and gentlemen, without further ado, allow me to introduce and request that the Honorable Minister of State for Provincial Affairs, Honorable Judith Ngube, addresses us. I thank you. Honorable Minister.
Last year, sithethwe by surprise ngomkhuhlane lo COVID-19. Sagijima angikholwa ukuthi ubaba uSivande ukuthi wayelala le team yakhe, angikholwa ukuthi babelala ngoba it was a nightmare ukuthi kambe abaza hlaselwa ngumkhuhlane lo sibafaka ngapi. Lanxa sathatha isinqumo sokuthi asigijimeni sithi refurbish, sithi renovate, asigijimeni senzeni bakithi, but sasilovalo ukuthi kuzahamba njani if the worst becomes to the worst. But engikubongelayo baba Mayor yikuthi sonke njengobulawayo savumelana ukuthi asinxuseni uNkulunkulu, asinxuseni umdali wakho konke angenele, kathumele umoya oyingcwele, usithungamele, athumele umoya oyingcwele uphephethe kube nganeno. Ngithanda ukuthi ngibonge baba ubukhona. You can actually feel the presence kaNkulunkulu. Hence namhla sibuthene lapha sesibuka one abasebenza lapha labo i-environment isisitsho ukuthi buyani lizosebenza eThorngrove. Sithanda ukuthi sibonge baba nge-commitment etshengiswe ama-frontline workers ethu. Siyabonga kakhulu, ngithanda ukubonga on behalf of government ukutshengisela i-commitment le-dedication phakathi komsebenzi omkhulu, phakathi komsebenzi onzima. I have always been saying ukusebenza, ukuba ngumongikazi, ukuba ngudokotela, it's a calling more than anything else. It's a big calling. Angikwazi ngingayichasisa njani, kodwa nxa uvele wahlatshela umkhosi awuphumi kuleyo avenue. Hence i-government inanzelele ukuthi lanxa sokuzuzakale ama-vaccines awokuqala lingeneyo nalawo i-200,000, ihulumende yahlathi let's target first target group yethu ama-frontline workers ethu ngokunanzelela i-commitment, ngokunanzelela i-dedication yokuthi ilizwe lethu lisizakale, izigulani zethu zibe well catered for. With that, Baba Mayor, allow me therefore to say it is a big privilege for me to join you this morning in the spirit of partnership and goodwill. I first want to commend His Excellency, the President, Comrade Idim Nangagwa, and his administration for their leadership and decisive action during this difficult time. The government of Zimbabwe, early and ongoing response to the COVID-19 crisis has been robust. The challenges we face today requires continued cooperation between our government, donors, the business community, the private sector, and the civil society. Today's handover of hospital equipment and healthy products has been made possible by the generosity of the Open Society Institute of Southern Africa. This donation is critical to Bulawayo's response to COVID-19, as the equipment will help save many lives. On behalf of the President, His Excellency, Comrade Idim Nangagwa, the people of Bulawayo, and on my own behalf, I am very grateful. And I would like to thank the Open Society Institute of Southern Africa, who saw it fit to donate towards this worthy cause. The government recognizes the work they are doing in the fight against the COVID-19. It is my hope that the support will go a long way in the management and treatment of COVID-19 cases in Bulawayo. As I close, let me restate that COVID-19 is real. COVID-19 is here. We know through our work in communities that citizens are generally becoming less cautious and not fully adhering to prevention measures. I am once again appealing to the people of Bulawayo that we heighten our vigilance, as we have many examples across the world of how confirmed cases can rise quickly and overwhelm the system and undermine our collective good work. This is not time to relax, but time to increase our adherence to the guidelines that have been given by the World Health Organization and the Ministry of Health and Child Care. Together, we shall overcome COVID-19. Together, we can make it. I thank you. Ngiyabonga.
Ngiyabonga.
Good afternoon, ladies and gentlemen. My task is to thank everyone who has made this day or event a reality and a success, and also to thank those who have made this institution to be in this state. Right. Starting with His Worship, Mr. S. Mkoni, the Mayor of the City of Bulawayo, Honorable Minister of State for Provincial Affairs, Honorable Umama J. Ngube, the Chairperson of Health and Housing and Education Committee, in absentia Councillor S. Ntando, then OSISA, represented by Mr. I hope he won't be offended, I would like to call him by his full name for a reason, Siposam Malunga. The reason being that I'm feeling so good and proud to be associated with this organization, particularly because he was my schoolmate during our days at high school, at a school called Bundu, but it's Mzingwana High School. The members of the media, council staff, everyone who has made, as I said, this day or this event a reality, because obviously it was planned for some time or for some days, but today is a reality. It's happening, we're here, we're witnessing. We're getting a very big donation. All donations are always big. A very big donation. Like I said before, that even those who were involved before to make this institution to be at this state. Mind you, we had funding from government to start with, renovating and improving the superstructure. With people coming in to donate detergents to make sure we disinfect our wards, our all other facilities. With people who donated PPE to be used by frontline staff. People who donated sanitizers to protect or sanitize our frontline workers. And everyone else, as I said. And now the awards which have been made to be ready to receive patients, but you can't make them sleep on the floor. Hence, we received or are receiving today such a donation, and we're very grateful to that. And as I said before, we'll never stop wishing or expecting more donations, because as it is, the cases may appear to be going down, but maybe it's just a phase. It's just a phase. We may find ourselves in a dire situation once again, where we'll have to find ourselves all these beds being occupied by patients. Though umama uthe xa uthe sakufaka uNkulunkulu, we pray that we don't get to such a situation.
Amen.
I've just realized that my director has just joined us. Welcome, Dr. Spanda. Right. I think with these few words, ladies and gentlemen, as I said, mine was to thank everyone, and I think I've tried to thank everyone. Thank you very much.